Hi, welcome to Tea Time. I'm Shethi Narula here from the Unitech Golf and Country Club in Noida. And on the show today, I've got the CEO of Fortis Healthcare, Aditya Vij. This man has seen it all in the corporate world, from General Motors to Fortis. Today on Tea Time, he talks about the healthcare sector in much detail.
On the show this week, we have Aditya Vij, CEO, Fortis Healthcare India.
Simply because the healthcare industry is growing more rapidly than industry in general. Right. There has been a lot of PE interest.
In news, Billy Horschel wins the Tour Championship by 3 shots and claims the FedEx Cup. And Justin Thomas wins the nationwide Children's Hospital Championship.
Hi, Chethi,
Hi.
how are you?
Good to have you on the show today. So you're a man who's come from General Motors to Fortis Healthcare. How much are you enjoying the switch right now?
Oh, very much, I must say.
Really?
There's so much to do in the healthcare sector that whatever little you can contribute is not enough.
Sure.
The country is at very low level of penetration in healthcare, so it's been a right choice for me.
Where does India stand today as far as the healthcare sector is concerned vis-a-vis the rest of the world?
In terms of GDP spend, we're still very low.
Right.
In fact, if you compare data,
Right.
in 2000 we were at 4.4% of the GDP spent on healthcare. And in real terms, actually in 2010, we were at 4%.
Sure.
So actually the GDP growth has been higher than the healthcare spend, if you may. But I think what is very positive now, with the latest information that we have and some of the moves that the government and the policies that they're coming up with, I expect that this growth will accelerate. We have so much to do in terms of still creation of infrastructure.
Right.
Just to come to the WHO standards of 3.5 beds per 1,000 people, we have to create 1.2 million beds still.
Right.
And we're sitting at about 1 bed per 1,000 population against the WHO recommended 3.5.
3.5.
So a lot of work to do in terms of creation of capacity. The other thing, I guess, which is a very big challenge in healthcare, is manpower. I think more importantly, skilled manpower. I think we have some of the best clinicians in the world, but the ratios against the population that we need to service are still quite low. The good news, like I said, is that everybody's focused on it. There's a lot of dialogue between the government and the private sector.
Right.
How to accelerate the delivery of growth.
Right.
And we can see significant investments that the private sector is making in partnering with the government as well to make sure that we create more capacity.
The government also somewhere is giving a push to the private sector to make the significant kind of investments required in the healthcare sector, isn't it?
Yeah, that is correct. And I think the other thing that is going to be a big enabler is technology in the future. So
yeah.
I think from our perspective, you know, we've been at the forefront of technology.
Right.
First, obviously, the creation of infrastructure. Then making sure we have the latest technology in our hospitals to be able to service all kinds of patient needs. And the piece that I always give as an example is enabling critical care at remote locations through technology.
Right.
So we run a concept called EICU, for example, which is really an electronic ICU with a central command center at one of our large hospitals in Delhi. And that is actually servicing ICU beds, critical care beds, at already 12 hospitals across the country through live cameras that our intensivists at the central location can actually monitor patients and direct the nurses and the junior doctors to deliver the kind of care that the patient requires.
All right. On that note, I'll tee off and we continue discussing.
Yeah, absolutely, sure.
Now, we were discussing a few numbers as far as the healthcare industry was concerned. I'm going to touch upon medical tourism as well in a bit. But the Indian healthcare sector today is one of the fastest growing sectors in the world, and recent reports have proven that it is growing at a compounded annual growth rate of about 15.2 thereabout percent year on year. And by 2017, the report says that we would be seeing growth at $160 billion as well. Now, how much is this in line with your estimates at Fortis as well?
No, actually, the growth has been tracking pretty much on the lines of the prediction that was made in 2008.
Right.
I think the data you're quoting is dates to 2008.
Right, that's right.
The industry already touched close to 90 billion. If you talk about the 15% growth, give or take, we'll be at 160 billion by 2017.
So that's a fair estimate,
about,
which I just mentioned.
3 years from now.
Right.
And I think what is very important is that we talk about the value of the industry.
Right.
But there's a multiplier effect. When you compare it apples to apples, the value of the industry would be higher because the procedure cost in India is much lower.
Okay.
So this is also addressing a little bit of your medical tourism issue where cost is a huge advantage. And
yes,
service
medical tourism India does stand at an advantage to the rest of the world, right, because of the kind of cost advantage we are being able to provide as a country. Where do you see medical tourism really go from here?
So, we had about 1.2 billion patients through the system last year.
Right.
I expect that medical tourism is going to continue to grow around 25 to 30%.
Right.
I think last year's growth was about 27%.
Right.
I think the good part is that some of the very advanced work that we do at hospitals like our flagship at Gurgaon, which have technology that in fact is ahead of many major well-known names in the international arena, considering that it was actually awarded the second most technologically advanced hospital in one of the recent researches, provide us the opportunity to actually service patients of all kinds, even with very advanced problems.
Right.
And one of the areas that's rapidly growing is transplants, as an example, which are complex, which actually are not available that easily, certainly in the African subcontinent, the Middle East, and so on and so forth. The other thing is the overall arbitrage is going to make it even more economical for even the West to look at India. We do have a few patients even today coming from North America and some from Europe. But I expect that to grow as well as medical delivery continues to get more expensive there. Nice shape.
Thank you. The budget this year said that they would like to increase the FDI cap on insurance to about 49%, introduce 4 more aims, promote e-visas and ease out the procedure in visas for medical tourism as well. What does your take remain? Are we on track as far as the healthcare sector is concerned with the BJP government and their policies?
I think even prior to the BJP government, there's been very active dialogue in easing the process of servicing, let's say, patients from overseas as part of medical tourism. And it's very heartening to see that, and you know, one of the requirements we used to say was visas, more investment. So I think the BJP government in our initial discussions has been extremely positive. And, you know, we're very happy with the direction we are taking, and it's going to be a step at a time. But I expect that this will clearly continue to grow at the rapid pace we've seen in the past, perhaps accelerate further. Because the demand for medical tourism is far higher than we are able to service today.
Correct.
And, you know, many of these, either embassies or, you know, the countries that we talk about the inconvenience they may have. And considering that we are such a large country and establishing state-of-the-art infrastructure, we're actually a very small player in Asia, if I were to see. Clearly, Malaysia, Thailand, Singapore are far ahead in medical tourism.
Right.
Because they've invested in infrastructure, facilities. It's easy to get visas on arrival and so on and so forth. So some of these policy statements that the government made and some of the policies they've already announced are going to be very positive for medical tourism growth in India.
Right. Now, you know, your expansion plans sure seem to be on track, and obviously there are large startup costs. Given these startup costs, do you think you're going to see any kind of margin compression in the quarters going forward?
No, in the case of Fortis, I think we saw substantial growth in margins already in the first quarter.
Right.
You know, as you continue to commission high number of beds every year,
right.
There's certainly a little bit of pressure on margins.
Right.
But considering, you know, the scale that we have and our focus, majority of our focus back on India, you know, 94% of our revenues come from India today. We are very confident that we'll continue to grow margins. And as I said, mostly it is to redeploy what we earn.
Right.
That really is the objective.
Sure. Fabulous. 500 to 600 beds is what you plan to add between your Ludhiana, Chennai, and one more facility, if I'm not mistaken.
Yeah, so,
you've got...
Yeah, so when we talk about 500, 600 beds, that's a generic statement.
Right.
What we have under project construction, as we speak, is our second facility in Ludhiana,
right.
which we announced a while ago. We started construction there. We're actually almost doubling capacity at our large hospital in Bangalore, Bannerghatta, which is actually known
right.
for medical tourism from the West as well.
Right.
With some of the best clinicians. There's a huge opportunity to deliver even higher level of healthcare. We don't have oncology services, for example, so we're certainly going to invest more in technology, and we're adding 210 beds there to the existing 240-bedded facility. The third one that we've already announced is another mother and child, a La Femme, Fortis La Femme at Bangalore, which we will commission yet this year. We are at launching point of our second hospital, large hospital in Chennai, 200-bedded hospital at Arcot Road as well.
Right.
So when we talk about 500 to 600 beds, that's our estimate of what we will continue to invest. We obviously have latent capacity within the system in terms of existing properties that we have and some of the land that we have access to. And given that, you know, with our asset-light strategy and having the Religare Business Trust to support us on infrastructure investments, it becomes relatively easy for us. It's more an OPEX model for us now. So it's the creation of capacity and maintaining the same standards.
Interesting.
Which is critical. So with 500 to 600 beds, capacity addition at today's level would be about 11 to 14%. But then with the existing hospitals delivering better productivity and higher throughput, we expect that we will continue to grow north of 20% a year.
Well, we continue to discuss Fortis's plans going forward, of course, on the other side of this break, and also find out if SRL Diagnostics, which is a subsidiary of Fortis, is planning an IPO or bringing a strategic investor in or not. All this and more on the other side. Take a break. We'll see you there.
Nice.
Thank you. Thank you for staying with us on Tea Time, and welcome back. We're in conversation with the CEO of Fortis Healthcare, Aditya Vij. Your India hospital business has seen a revenue jump of 20% to 964 thereabout crore Indian rupees as well. What would you attribute such stellar figures to?
No, like I said, the industry typically grows at 15%, and historically we've grown normally north of 20%. So we are very much on track on our budgets for the year. One of the parameters that we talk about is average revenue per occupied bed, and that's what I referenced in terms of throughput as well.
Yeah.
So our average revenue per occupied bed compared to last year, the same time, is already about 10%.
Right.
And then with filling additional beds, we commissioned many beds last year, close to 800. We've been able to deliver that growth. Clearly, we expect that we're going to be able to maintain this level of growth in coming quarters as well.
Sure. SRL Diagnostic, your subsidiary, are you planning to come up with an IPO soon, or are you looking at a strategic investor for SRL right now?
We are very encouraged by their growth. They've been growing rapidly, utilizing existing capacity. And not only that, they continue to add new labs, new collection points, and more importantly, new list of tests every quarter. So clearly, the diagnostics industry will continue to grow as well in parallel to healthcare delivery, and it's an integral part of healthcare delivery. Hence, our close connect. For us, any form of, let's say, an expansion-led strategy, we will evaluate options, whether it's an IPO or otherwise, to further fund growth in the SRL sector and unlock more value for our shareholders as well. So a final decision has not been made, but certainly during the course of the year, we're evaluating if there may be opportunities.
To come out with an IPO?
Not really an IPO, but perhaps...
a strategic investor?
No, we haven't thought this through yet.
Okay.
We're still studying the opportunity.
Okay.
And at the appropriate time, we'll announce it.
All right, interesting. Now let's talk about your Singapore unit, your facility in Singapore. You own 100% of that facility. Are you planning any kind of divestment soon on that front?
So Singapore, one is we are running a specialty hospital at Adams Road, and then we are running one of the largest diagnostic chains primarily focused on radiology services. Doing extremely well, actually, the radiology business. The hospital is a small hospital. So as our focus is mostly on India, I think we will continue to do what we do in terms of our presence. No major plans in the short term to expand further in Asia, as we've just decided to come back and focus on our own market. But I think for now, nothing to announce in terms of divestiture.
Talking about investments now and strategic investments, of course, do you think this sector has somewhere become a hotspot for PE investors?
No, clearly, simply because the healthcare industry is growing more rapidly than industry in general.
Right.
There has been a lot of PE interest. In fact, we've had strategic investors in IFC and Standard Chartered Private Equity invest with us last year as well. And I know that our competitors have had a fair bit of activity there as well. So I would expect that even in the foreseeable future, we'll continue to see that degree of interest. Perhaps it will grow to a certain extent.
What about the Green Corridor initiative that you've just launched? Let's talk a little bit and elaborate a little on what that initiative is all about.
So, in the last quarter, actually, we launched, we'd been doing a lot of work already, but we launched the Fortis Center of Excellence for heart failure and heart transplants at Chennai.
Right.
And I think whenever you talk about cadaver transplants, you have very little time So some of the state governments have worked very closely with us to ensure they're able to save lives. And what it really means is a complete clearance for our ambulances that are carrying the organ
Right.
for transplant.
Right.
So recently we had one actual case in Chennai and one test case here from International Airport in Delhi to our flagship in Gurgaon, where the government worked with us. Most important constituent of the government were the police, who really facilitated this activity. And really what the Green Corridor means is that you have a pass-through for your ambulance through and through. And we did about 15.2 kilometers in under 15 minutes, which is excellent timing given our traffic and the complexities we have.
Isn't this something that we require all over the country today, given the traffic levels rising in urban India? In case of emergencies, don't we need designated corridors, more such of these for the country in general?
I think it's fairly common in the West.
Yeah, but we don't see that in India.
Clearly,
at all.
today's awareness levels are going to encourage a lot more activity. Like I said, we work very closely with the government now.
Right.
And I would expect more and more of this to happen. But certainly you're making a valid point that a lot more needs to be done in this area. And some of the state governments are fairly actively involved. You may be aware of the Andhra case where they're running several thousand ambulances centrally as well.
Sure.
So be able to reach the patients on time, which is fairly critical.
Interesting. Let's finish our game and we discuss your golfing escapades as well.
Nice putt. Oh!
Just missed it by a whisker. So you love your game of golf, isn't it?
Yeah, I mean, I guess when you work in our industry and you work the kind of hours we do, you have very little opportunity. But I do take out time on early Sunday
Sundays.
morning for 9 holes. It's family time too, because my brother and I play together every Sunday, religiously actually.
And which is your home course in Delhi, really?
So we play actually at Manesar at Classic Golf Resort, which I consider one of the best courses in the country actually.
You love that one?
Yeah, it's very picturesque.
And obviously this calm and collected attitude in life obviously is something which is a takeaway from golf course, or is it otherwise?
So I call golf therapeutic. So as much as my senior clinician colleagues will tell me, rigor around life, I think golf is special. I mean, I'm reasonably active. I have yoga classes thrice a week. I walk the rest of the days. When I travel, I try to go to the gym or actually go for a walk outside. But Sunday, try to, manage some golf, simply because when you're on the course, all you're focused on is the greens, the environment, and your ball. So fairly interesting. I find it very, very relaxing, and you'll be surprised. Even amateur golfers like ourselves may have a late evening on Saturday, but are up at 4:30 in the morning on Sunday to go to the course.
All right, on that lovely note, thank you so much for joining me on the show.
Thanks so much, Shaibi. It's a pleasure talking to you.
Likewise. Well, that is a wrap from me, Shaibi Narula, and the CEO of Fortis Healthcare, Aditya Vij. I will see you next week again with another guest from an entirely different sector altogether. Until then, enjoy the flight of a good drive. I will see you next week. Take care.